Good morning, I'm Katerina Lukatich, and this morning we are taking 5 with Dr. Stephen Simpson and nurse practitioner Victoria Bowman, both of Jubilee Primary Care. Thanks so much for joining us this morning.
Thank you for having us.
Thanks for having us.
So today we are talking about dementia. Dr. Simpson, tell us a little bit about the different types of dementia.
There's several categories. The biggest one everyone knows about is Alzheimer's dementia, but there's also things like Lewy body dementia and frontal lobe dementia for younger people, things like that.
It's one of those things that you really want to catch early. Why is early detection so important?
So there's actually no treatment or medication that can reverse dementia after it's already started. So finding it early gives you the ability to start those treatments and slow the progression.
If someone thinks that they or a family member might be starting to show signs of dementia, what would that appointment with you look like?
One of the first things we'll probably do is look for things that look like dementia that are mimics of it that are potentially reversible. There's a lot of things like thyroid problems, B12 deficiency, urinary tract infections. Depression's a big one that often mimics dementia.
So if someone comes in and they are actually diagnosed with dementia, what are those things that you are able to do for them?
One of the biggest things is tracking over time with different types of surveys and cognitive tests. We also have, as she mentioned, various medications that, when appropriate, can help hopefully slow the progression of dementia.
Dementia is something that doesn't just affect the patient, it affects caregivers as well. Are you all able to help guide people on the best way to move forward?
We are. So our patients actually have a whole team approach. They obviously get Dr. Simpson, a doctor, and a nurse practitioner like myself, and we can work with social workers to get home health and hospice and different types of services to the patient's home if it's reached that point, and also support for the family as well.
And that's one of the great things about Jubilee Primary Care is that you all are focused on the patient and you're focused on a little bit longer visits than some other physicians may be. And that's what people are looking for, right?
Right. With us being a value-based clinic, we're able to spend much longer visits and spend a lot more time doing a lot of the social and not just medication medicine support, but the actual social support that's needed.
All right, thank you all so much for joining us. Jubilee Primary Care, locations both in Baldwin County and in Mobile. They're there on your screen as well as the number.